Hey guys, my name is Jessica. I am currently living in North Carolina in Fayetteville. I'm originally from New York City. Um, so my experience in the field, when I lived in New York, I worked in foster care as a home finder for 2 years. So what I did as a home finder was pretty much place children in homes and make sure that the homes were suitable for the children, that they had fire extinguishers, carbon monoxide detectors, um, smoke detectors, and I was the one in charge of licensing the foster parents. And now that I live here in North Carolina in Fayetteville, I moved because my husband joined the military, so he was stationed in Fort Bragg. I started my first year field placement in Carolina Treatment Center of Fayetteville. Um, I did. I was there for a few months, pretty much until I finished my first year placement in April, a few months ago. And right after I finished, the director and the supervisor decided to give me a position there. So I'm currently a counselor, a CSAC registered counselor. So at Carolina Treatment Center of Fayetteville, what we do is substance use disorder, mainly opiate use. So we help patients by treating them with their opiate use and their cocaine use, and if they have any other substance use disorders. So currently, I'm working as a counselor. What I do there now, it's a little bit different than what I did when I was an intern. As an intern, I was doing screenings, intakes. I was filing. I was discharging files. And once in a while, I was given the opportunity to do group sessions. Now, as a full time counselor, I have my own caseload of about 40 patients. I do group sessions, I do one on one individual sessions. I also do intakes and screenings. And we work with different types of insurances like Medicaid and private insurances. So we do have about a little over 600 patients at our facility. We help them out with medication, so we provide methadone, Subutex, Suboxone, Vivitrol. Um, so identifying goals for developing into a clinical social worker. So I would definitely like to learn more about, clinical social work to eventually work in a hospital setting. That's kind of like my ideal goal. I mean, right now where I am, it is clinically oriented because I do work, we have medical staff there, we have nurses on, um, at the facility, we have a doctor, we have actually two doctors, and then it's 12 of us counselors. Some challenges that I foresee in my future as a clinical social worker is possibly crisis interventions. I know I haven't yet dealt with one at my job, but I have seen them with other counselors and supervisors and other staff members. So that is one of them, probably knowing how to calm the situation down and knowing how to address the patient when they're in a crisis is going to be something, a challenge that I know I'll definitely overcome and manage. Something else is probably, well, in relation to the crisis intervention, if a patient is like suicidal or having homicidal thoughts or ideations, that's probably like a challenge that I foresee myself having to ask, like my supervisor for advice or my director or anyone that can really give me some assistance if a patient is going through, especially at my clinic, like we hear about of a lot of our patients overdosing due to them taking too much Percocets or heroin or cocaine. So that's definitely a challenge that I will probably see in my near future. So I look forward to hearing from you guys and I look forward to this class. Bye.